Hey, Polly.
Hey Greg, how are you?
I'm all right. As people will see, we're not together today.
Right. Look at I'm like, oh, all this room. I got my feet up. Actually, not. I caught myself like way over here before.
So I've been kicked out of the studio.
Yeah, yeah.
But
Maybe
I am from
maybe
home
you'll
today.
tell everyone the reason later on what you did to get yourself kicked out, but for now, it'll be a secret.
For now, we'll just skip it.
Yes, yeah.
But I am still so happy because we have the EOHHS on there. And I'm just going to use the acronym because the actual title is very long.
Well, I'm glad you got it in the right order, or at least I think you did, because you know me, I just throw out some letters and hope everyone knows what I'm talking about.
That's right. But we're being joined by Ashley O'Shea and Ellie Robinson today, and they are going to break down everything, including all these great acronyms that we keep hearing about and that we're affiliated with and that we all know and hear every day in the community. So I'm super excited to get them on because they're going to be talking about youth behavioral health services and programs that are out there. So that's, near and dear to me because I have the three at the house. So I'm going to be ears are wide open on this one.
Yep, one of the some of the most important resources around. Yeah.
Yeah. So without further ado, today joining us on Totally Preventable, we have Ellie Robinson, the Director of Children's Behavioral Health System of Care for the Executive Office of Health and Human Services, and Ashley O'Shea, the Director of Strategic Communications for the Executive Office of Health and Human Services, and the mom of two school-aged children. Ashley, Ellie, how are you both doing today?
Great. Thank you for having us today.
Yeah, really excited to be here.
Greg, I want to give you a shout out. That was a mouthful and you did great.
Thank you, thank you, thank you.
So true. We
I
don't
may have
like to
done this.
use acronyms, but you got to tell people where we are. It's a lot. Thank you.
I've done this once or twice.
Yeah.
No.
So to start off like we normally do, I'll address this to both Ellie and Ashley. Could you give me some background on kids' behavioral health in Rhode Island and the updated website that you've developed?
Yeah, so at the Executive Office of Health and Human Services, I oversee our interagency child well-being group internal to the state. And we really found that a website like this was something that was missing for parents and caregivers across Rhode Island. And so we worked with our partner agencies, including our Department of Children, Youth, and Families, Behavioral Health, Developmental Disabilities, and Hospitals, the Department of Health, Department of Education, and our community partners to develop content and structure and really all of the flow that went into this website.
That's
That's
great.
right.
Yeah. Did you want to add something, Ashley? I'm sorry.
Oh, I just wanted to say, by way of development, I was the communications lead for this project, and we worked with communications agencies across all state government, from the Department of Education to our governor's office to, like Ellie said, I'll use the acronym DCYF because she didn't, Department of Children, Youth, and Families, all these behavioral health, developmental disabilities and hospitals, BHDDH. We really partnered with dozens of state professionals, as well as clinicians and experts in the field, to build this really comprehensive resource. And it's been a pleasure to do this. And I didn't know if you wanted to know a little bit about our personal background as well. But before I was at EOHHS, Executive Office of Health and Human Services, I was in Governor Gina Raimondo's office. And before that, I was in the private sector. So it's great to be working on really impactful communications that really touch the lives of people each and every day.
Great. Would you like to tell us a little bit about your background now, Ellie?
Yeah, I'd be happy to. So I'll sort of kind of like an intertwined approach to the personal and professional intersection of behavioral health for myself. So I was born and adopted in Rhode Island, and I've lived in Rhode Island ever since. And being an adoptee, it's really a lifelong journey of navigating my own well-being and what that means from an identity standpoint, and just sort of understanding myself and how I fit into this world, and lots of mental and behavioral health components to that journey for sure. Um, so that is an ongoing, lifelong thing that I do. And then on the professional side, and very connected to that personal journey, I started 2 careers ago, working at Bradley Children's Hospital in the PD partial program. I was there for a couple of years doing direct behavioral health services for the littles, so ages 0 to 7. And then I ventured to a nonprofit, an education nonprofit for some time, really focusing on managing our partnerships with the schools we were serving, with an emphasis on the non-cognitive and identity development and community building pieces of helping low-income and first-generation students decide what their post-secondary world would look like. So it was sort of a combination of that socio-emotional and non-cognitive pieces of the education world connected to the HHS world, I would say, Health and Human Services world. And then found myself at the Executive Office of Health and Human Services, and I've been here since 2021.
Well,
Nice.
thank you both again.
So we've gone a little bit out of order here, but I'll take the next question, Greg. Okay.
Yeah.
I usually forget that it's my turn, so I'm warning Greg, I'm butting in here. So what should parents do if they have questions about their child's behavioral health? And could you also like give us a little more detail on what behavioral health is in case parents aren't concerned what fits in that bucket?
Sure. We define behavioral health as any mental health challenges or substance use. And so those two things together relate to folks' behavioral health. And we created this comprehensive guide, kids.ri.gov. Now I'll say you could just go to kids.ri.gov, which is a little bit easier to remember than /behavioral-health. And there's a button for behavioral health. So kids.ri.gov, but you could certainly put the / in as well. And on that site, we have a list of behaviors to watch out for early on. Specifically, early intervention is key. I know your podcast is called Totally Preventable, and we're really trying to get to kids really early on so we can potentially prevent some really dire consequences later on if we can really focus early on their needs. Tips for how to prepare for communicating with your family doctor and school. Local support groups and organizations for parents dealing with children's behavioral health concerns, ways to pay for therapy and other behavioral health services. And I know later on throughout this podcast, we're going to go into some of those different sections and what that really entails. It's very comprehensive, and we're really thrilled to be able to offer it to the community, specifically coming out of the pandemic. We're finding that more and more families are needing these resources.
Ashley, how can we help reduce stigma around these important issues?
We can talk about it. I think
Mm.
for a long time, intergenerationally, maybe folks didn't talk about behavioral health challenges. Maybe they didn't even think of them as a behavioral health challenge. And we're just trying to reduce the stigma and be a resource for other parents. My message and Ellie's message today is don't judge. You really don't know what folks are going through. It could be your own family member, and you may not know the path that they've walked on. Ask questions, seek to understand. I think for many of us, behavioral health issues can be very triggering for folks, but if you could seek to understand what's happening, understand a diagnosis, understand a child's journey, understand that behavior is communication. We like to say that. It might be a really tough piece of communication. I know when I've seen behaviors that I've been told our communication, I don't necessarily want to receive that type of communication. We're talking about really difficult stuff here. So just be kind, be understanding, and listen.
Do you think that there might be different stigmas? Like, I know we say that we're trying to reduce the stigma, but do you think that parents and children will experience different stigmas when it comes to behavioral health?
Yeah, I will. See that. I think sometimes the kids are able to heal quicker than the adults in a behavioral health instance, between peers, for example. I think, again, we all carry our own lived experience, and we all carry our own thoughts about depression, mental challenges. We all carry our thoughts about treatment and about, we may know folks who've chosen to self-medicate through challenges. We may know folks who've chosen to go through treatment and have relapsed. We may know folks who early on are choosing a medication path for their child, whereas other parents are choosing to natural interventions. Some parents are choosing a combination. I think we all just have to understand that everybody's coming from a different perspective. So if we can, like I said, be kind, listen, understand, be on this journey alongside specifically those we love and care about, those that we want to understand. I think we'll all be better as a society for it, and we'll help these kids who really are struggling get to a better place.
Ellie, if there are parents listening and thinking this is a really powerful conversation and there's a lot of powerful resources here for them, what do you think the biggest takeaway should be?
Yeah, I think this really goes hand in hand talking about on the stigma. It's really like you are not alone in this. There are so many people, and probably more than we realize. Like Ashley shared, you often have no idea what someone might be going through. And we want if you take nothing else away from this at all, is that you are not alone in going through this. Not only are other people potentially experiencing something similar to you or something that they could potentially relate to, but there are also providers and supports and resources out there for you to navigate all of this. It can be a very isolating experience, whether you are the person having the mental or behavioral health challenge or you're caring for somebody that is having a mental or behavioral health challenge. It's really, it can be very isolating. It's scary. There's a lot of unknown. So our hope as we go through this conversation today and as folks begin to dig through kids.ri.gov really will be to equip folks with some common language to use, some ways to better understand what they might be experiencing and how it fits into the behavioral health world, because that alone can be a pretty foreign sort of concept for folks. We don't all have that language. It's not, we're not just sort of naturally understanding that necessarily. So that's our hope, really, to begin to build community around dealing with these challenges and offering some language and tools and resources for doing so.
You said build communities because we built this podcast, a totally preventable podcast, because we wanted the community to know about the resources and services that are out there. So those the services that they had no idea were out there that they have access to. So Ellie, can you tell us about any other important policies and programs that people should know about?
Absolutely. I would really like to use this as a moment to highlight certified community behavioral health clinics in Rhode Island. So we officially launched the acronym there is CCBHC, and for the sake of time, I will use that acronym for the rest of this question. We officially launched CCBHCs statewide. It was a true interagency effort. Again, all of the Health and Human Services agencies and really beyond. It took an all hands on deck approach to getting CCBHCs rolled out. And as of October 1, the state is covered by CCBHCs. All of the different catchment areas or geographic locations in the state is how each CCBHC is sort of designed to serve their local community. So a CCBHC is a specifically designated outpatient clinic. So it's not residential, it's not inpatient. It is a kind of place you can go for like in outpatient services, so like receiving therapy, and then you go home. And they provide a comprehensive range of services, including things like all types of mental and behavioral health support, substance use services, supports for health-related social needs, which we will talk a bit more about later on today. And I want to double highlight that there is 24/7 mobile crisis response available via CCBHCs. And what that means is that you can receive a response in person wherever you are from a clinically certified a clinician to come to your home or wherever you may be in the community if you're having a mental or behavioral health challenge. Within 1 hour of making a call, someone, if it is the right response, someone will be there for you in person to help you navigate whatever it is that you're experiencing. So on the children and youth side, that version of mobile crisis is called Mobile Response and Stabilization Services, another acronym, MRSS. And a really important highlight of the MRSS program is that the family defines the crisis. So what that means is any parent or caregiver or sometimes school staff will be supporting a child in call, or they might be at an after school program. Really anybody who is working with a child or youth can make this call. And again, someone will come in person wherever you are. You might be at home, you might be at school, you might be at the playground, wherever you are. Someone will meet you there and support you through really mitigating whatever the immediate crisis is at hand, and then providing stabilization until you're at a point where you're ready and have identified what the right next step is for your care or your child or youth care. And then moving forward, they'll help connect you to that service and stay with you until that connection is made.
Is there a threshold that has to be met to get a mobile response, or is it just if they say I need a mobile response, you just send a mobile response?
Yeah, so it really is focused on the behavioral health crisis experience. So I would like to also share if it is an immediate danger or if someone is immediately in an unsafe position, 911 is still the number to call. When it is a behavioral health need or something that a child is experiencing and a parent or caregiver needs support, you can call 988 for that. And that is where you'll be connected to a mobile response and stabilization services provider. Part of that first contact is a triage experience. So they will walk through what is going on, what are you experiencing, and the threshold really is around how immediate the response needs to be. Is it right now within that 1 hour? Is it within a 24-hour period? Is it a connection to maybe you have a therapist, but it's 10 o'clock at night and you can't get in contact with them? So they really help triage and then make determinations in partnership with the family of what the right next step is.
That's great. We've heard a little bit about the mobile crisis units, and they sound like a fabulous response for some people. Ashley, could you, in your experience, maybe go over some of the warning signs that a child may be having some behavioral health challenges that are overlooked, and what parents can look for?
Sure. Recognizing signs early to get support is so important. Early intervention is really, really key. So some things you might want to look out for are your child stops taking care of their personal hygiene or grooming, they refuse to shower or bathe, their appearance is changing, they're suddenly gaining a lot of weight or losing a lot of weight, could be signs of some eating disorder challenges. They could have really big mood swings. They go from very sad to angry to irritable very quickly. They could have some withdrawal symptoms. They'll pull away from family, friends, activities they used to love, like sports or clubs. They may have some increased irritability, more frequent and intense bursts of anger or frustration. And again, those can be some of the scariest ones, can be really, really hard. Sleep changes. They have trouble falling asleep. They get nightmares often. They start sleeping in too much. They're missing school because you can't get them out of bed. They're doing school refusal. Appetite changes, which is related, I think, to sometimes that weight gain or loss. Concentration issues, specifically if a child may be having some ADHD challenges, they might have trouble focusing on tasks or their grades are starting to drop. They might worry or be anxious more than usual. They may have some physical complaints. Sometimes you can have a stomach ache or a headache that's really actually related to some of what's going on with your behavioral or mental health. you might get a call from the school. That's one of the biggest red flags. The school's saying that there was a recess fight or a drop in performance or conflict with a teacher, classmates. Sometimes, those teachers and administrators, they see your kid 7 hours a day. So they know if something's off with your kid or if there's a peer interaction or multiple peer interactions that aren't going the way that they'd like it to be going. That can be a really great big flag. They could act younger, like start wetting the bed when they didn't used to do that. They might be doing some really risky behaviors, taking risks with their lives, which can be super scary. They might start experimenting with drugs or alcohol. They might have trouble expressing their feelings, or they may have some self-harm or suicidal ideation thoughts. And those can kind of raise the gamut. Depending on the age group of the child, some of those symptoms are more likely than others, but those are some of the signs.
What would you say to parents who may see some of these and brush it off as just adolescents, kids being kids, growing
Yeah.
pains?
So our campaign is called, I think our tagline is something like typical behavior or something more. Check out kids.ri.gov and learn more. Uh, Look into it. I mean, look, I'm not here to tell parents what to do. We're here to provide a resource. So, certainly, some of the things that I outlined, you may say 20 years ago, of course, I personally was taking risks with drugs or alcohol. That's like a sign of adolescence. Well, the drug supply is tainted right now. And a child having one pill one time could end their life. So things might be a little different than they were back in the day. And I know that's scary. But I think we all, as parents, just have to decide, and as caregivers or as the folks that care about these families, like where do we need some more intervention? And what's going on environmentally, like the fact that the drug supply is tainted, where I actually can't allow this child to take this risk with their life because that first experiment could be their last. And there's no going back from that. And it could be totally preventable. To go back to your saying, we could prevent substance use crises if we help when the kids are just starting to think about experimenting. So, it's this is hard. I don't think there's any one size fits all. This is exactly what you need to do. Here's the path, here's the plan. We tried to come up with a pathway because we knew one was lacking in the state, but we know that every family is going to be on their own journey. Some therapists are going to work for some kids aren't going to bond with that therapist right away. Sometimes it's going to take a few different times to figure out the best plan for your child and their specific needs. And as your child ages, it's going to change. So it's a journey for sure. And yes, some of this stuff you could wait it out, and that's a strategy if someone wants to do that.
So, I,
Go ahead.
I'm sorry.
Go ahead.
I was just going to say, so I think this is very important for parents to know. So when they see these or when they see a combination of these, what should they do next? What's the next step?
So approach your child with kindness and understanding. Something I want to say is you cannot de-escalate an escalated child when you're escalated. So when you're in a screaming match about an issue, that's not the time that your child's going to bond with you and say, you know what, I do want to get some more support, mom or dad. So be kind, be understanding, talk to them without judgment. Visit our website, kids.ri.gov/behavioral health. Consider reaching out to a mental health professional if needed. Ellie gave you some more instant type conversations because there are sometimes for certain professionals, you're going to wait a little while to get in with them. That's why we've done a lot of work to get some of this instant access to those parents that feel that I really need support right now, even if it's just someone to talk to help me triage what's going on. Because getting help early can just make a big difference. There's lots of resources and professionals that are ready to help you and your child through these challenges.
Thank you.
Greg, I was going to say, I don't know if you ladies have seen a hidden in plain sight demonstration we do those here. So we make up a mock teenage bedroom, and we have risky behavior things scattered throughout it for everything, for eating disorders, for substance misuse, everything. And your list kind of reminds me of that. Like, you're not going to see all of those things in your kid's bedroom. And even if you see some of them, it doesn't mean that there's something going on. It's an opportunity to start a conversation and be more involved and ask your kids some questions.
Yeah.
You don't.
I will also want to say that our website is evolving. So if you have resources that you think from your organization would help parents, please send it to us
All right.
because we'll work with our team and maybe that photo should or that image should be on a page somewhere. Because we're trying to kind of put together all the different resources that are available. And that's something that like we didn't make at the state, but if our prevention coalition partners have that, that could really help somebody who has a teenager who maybe wouldn't know even what to look for a vape. I gotta tell you, when I was growing up, we didn't have vapes, and I don't think, I'm not even, I guess I'm middle-aged these days, but I'm just, some of this stuff's so new looking. It could look like a pen, you
Yes.
know? So,
Right.
like, you might not know what you're even looking for.
Exactly.
Absolutely.
Mhm.
So, Ellie, when we're talking about behavioral health, prevention is more powerful than intervention. And we believe that here at the Prevention Coalitions too. What can families do to build some more resilience in their child's emotional health? Just to help before things go awry.
Yeah, this is so connected to everything that Ashley was just talking about and the example you just shared, Polly. Like, everything isn't necessarily an indication that something is going on, but some things we can do on the preventive side is really around sort of putting in place some healthy everyday habits, right? Like, what can we do so that should things begin to change, we have a better eye on that, a better ability to sort of track that as a parent or caregiver of a youth. So this is some tips from the American Academy of Pediatrics. And I would really like to frame this by saying that this is sort of the health related social needs piece on the prevention side that I think is so critical when we're working with children and youth and thinking about what we can do to prevent things from from falling into that sort of like, this is actually something more and not just a phase piece that Ashley was mentioning from our sort of campaign language and everything we've done around this website. So this is things like exercise, right? Like, moving your body, help staying active with your child or youth and encouraging them to do the same thing. There's a lot of research that shows the power that physical movement, whether it's stretching or sports or intentional exercise, whatever it is, has a huge impact on our overall mental and behavioral health. Similarly, sleep, getting a good sleep every night, that can help with things like as an adult, I feel like a whole different person when I get my good 8 hours versus when I don't, right? Thinking about the impact that even as an adult we feel, and when you're a child or youth, especially if you are struggling with some mental and behavioral health challenges, something like not getting enough sleep can really heighten and sort of emphasize all of the other pieces that may be at play around like emotion controlling, attentiveness, paying attention, overall just how we feel, those kinds of things. Nutrition, really a healthy balanced diet, what we eat, the you are what you eat saying. I have some mixed feelings about that one, but there's a lot that goes into what we are consuming, what we are putting into our bodies, and how this affects our mood, our ability again to pay attention. It's all of these things, these health related social needs, exercise, sleep, nutrition, all really tie together and are connected in our overall well-being and the impact it has on our overall well-being.
Ashley, we often hear about like access being a barrier, especially for working families or those in like underserved areas. What like innovative solutions are being explored in Rhode Island to close that gap?
Sure. So there's many different ways to cover the cost of these services. We have some overviews on our website specifically. Also, you can, if you need health insurance and don't have health insurance, folks can buy it via Health Source Rhode Island. There's different affordable options. Medicaid is available to families based on their income and family size. And we have some eligibility guidelines on our website. We cover about a third of the state on Medicaid. So when we talk about stigma busting, I don't want folks to think that if they qualify for Medicaid that there's so many other folks in the state of Rhode Island that qualify for Medicaid, and it's really important. One of the most interesting pathways that I'm aware of is the Katie Beckett pathway. This helps children with long-term disabilities or complex medical needs qualify for Medicaid if their family's income is above the Medicaid threshold for income. So if your child, this is more for when you're a little bit further down the pathway and you have some diagnoses, maybe you have more than one. You have some behaviors that are making it difficult for your child to be safe in school, or your child to be safe in an aftercare program, or we'll call it like neurotypical settings. If your child is demonstrating on a daily basis that those settings are not set up for them, you may be eligible for home and community-based services through the state Medicaid program, even if your income is well above the Medicaid limit. And I don't know that a lot of parents know about that, and so we really do want to spread word. It's a lengthy application process. You do apply via our office. It is not a quick solution. It will take a little while for you to first fill out the application. Your doctor has to help fill it out. And also you will have your paperwork processed by the state. And then there's an onboarding process if you want to bring on a partner to help you with your child's needs. But for those more severe needs, I think it's an important pathway that we wanted to talk about. And we have the Right Share program. There's more information about that on our website, as well as, like I said, how to apply for Medicaid, including the application that I talked to you about. So those are just some innovative solutions. Every call you make to 988 does not cost you anything. And I believe, Ellie, correct me, you're the MRSS expert. That service is provided, as is CCBHC's, regardless of your insurance or ability to pay. So I see her nodding her head. Go ahead,
That's
Ellie.
a really important point that I did not share when we were talking about CCBHCs, that regardless of your insurance coverage, you can receive services from a CCBHC.
Wow, that's
I have never heard of the Katie Beckett. That is, I'm so used to hearing about, once you exceed this income level, services are off, but I've never heard of this service before, and that's wow. Hearing that you can be above a financial level and still qualify for services is probably going to be a eye opener to a lot of people.
It helps a lot of people, specifically because many private health insurances do not cover home and community-based services. So again, if you have that child that's being kicked out of an aftercare program because they can't safely be in that environment, and you call your private health company to say, well, what do? I need somebody after school in my home. They may say, well, we don't cover that, but you could try Katie Beckett. So like I said, is not a quick solution. It will take a while, and it is for those kids with complex needs, multiple diagnoses, and there are some thresholds here, but helps a lot of families, a lot.
That really is terrific. I know there are a lot of resources out there that parents don't know of, so this is great. How can schools and communities and even workplaces support parents and caregivers managing families with some behavioral health issues?
Sure. So my first thing is be flexible and understanding of families' situations. Let's not go into the finger pointing game here. We're all here in the best interest of the child. So schools can support families by putting behavioral health supports in a child's 504 or individualized education plan. We partnered with the Rhode Island Department of Education for a really great understanding of what those two documents are on our website. I know myself, when my children entered kindergarten, I did not know what 504 our IEP was and what it stood for. And it wasn't until both of my children ended up needing some special support um, that I learned more about these documents. So I encourage you all to work with your school if your child needs that. Your school might give support via a school social worker, a speech therapist. They can offer something like social speech, which I had, again, never heard of until I was an elementary school parent, but that can help with expected talk and expected behavior, helping kids communicate properly with their peers, maybe not using potty language or using words that are inappropriate. Social speech can help with that. And that is something that can be added to somebody's individualized education plan, which I think is amazing. Many schools, including my own school, I am the chair of the local advisory committee for the special education group at Kingston Hill Academy. And that group is a group of parents and educators that come together on a regular basis to support kids with both 504s and IEPs. And that doesn't necessarily have to relate to behavioral health. Your child might have a 504 for a reading learning disability, for example. Your child might not have any behavioral health issues, but need those sorts of documents. But those families can come together in those meetings and be supported. The Rhode Island Parent Information Network, which is one of our parent resources on our website, helps support those groups across state government or across the state, all the state schools. And they're a great resource as well. They have regular annual meetings, as well as some other places like Parent Support Network has some great parent meetings. So, workplaces can be helpful by being recovery-friendly workplaces. Our behavioral health, developmental disabilities, and hospitals, BHDDH department, has a recovery-friendly workplace website and it can explain a little bit more about what that means. You can also offer parents flexibilities for their children's needs. Parents who have kids with behavioral health challenges may need the flexibility to go to a school meeting in the middle of the day, middle of a work day. And so as a workplace, if they cannot be worried about losing their job for that, that would be amazing. I mean, that's really what parents need is, again, it's on our community to support these parents and these families. Communities at large can host discussions on behavioral health and community resources at local libraries and community centers or schools. So at really every level of society, we could come together, and we do in lots of ways, to support this aspect of folks' health.
Really, you work closely on the development of resources like the updated website. What role does digital accessibility and cultural competence play in making these tools truly impactful?
Yeah, so I actually the first part of what I want to share here is really connected to what Ashley was just talking about as well. And I think when we think about, we've spent a lot of time today talking about how we can support our children and youth and signs to look out for and ways to get help and how to navigate that system. I think another really important piece of this puzzle is how are we caring for parents and caregivers? And if our parents and caregivers are not cared for, how can we expect that they are able to care for their children and youth? And a big piece of that that I like to highlight and work that we're doing both at the state and really beyond, our community partners are really spearheading this as well, is around the peer workforce and the power of people who may be experiencing something similar to you. So especially for parents and caregivers who are experiencing challenges or their children and youth are experiencing challenges, the opportunity to connect with other folks who are going through the same thing or similar things. There are lots of the organizations that Ashley was mentioning offer parent peer groups, and those groups are facilitated by parent peers themselves. So really highlighting the importance of lived experience in our work, in our workplaces, prioritizing hiring folks who have the lived experience of whatever it is that you are focusing on. That's really critical in this work. And I think is sort of a nice dovetail into the approach we took in developing this website and the content that went into this website. So like we shared early on, it was truly an interagency effort on the state side of all of the different program program staff, content experts, communications teams, all of the folks on the state side. And we also had at every step of the process, from content development, website design, images for the website, images for the campaigns, all of the different components of developing this, we had folks with lived experience. We really took advantage of our family work group that we have in partnership with Parent Support Network to provide input on content, on all of the different pieces that made this website possible. And we did not hit publish until we got their green light. Incorporated edits, shared feedback, all of the things that everyone on the state side did. So really prioritizing that being the case at every level and every step of the process when you're developing something like this is sort of a twofold response to the question about how workplaces and communities can support in this process, and also the approach we took in developing the content. And that most importantly includes things like having the content available in multiple languages. And when we have our ads, we're all in three or four different languages, I believe, and really making sure that we have, even like at our family work group meetings, when we're talking about these kinds of things, translation services available if needed, to make sure that we're sharing information that everyone who wants it can access it.
That's great news. Thank you.
Yeah, that is great. We have a staff member that goes to the family work group, so I hope she was helpful.
Amazing.
Ashley, if you had a room full of policymakers and parents, what myth would you want to debunk about behavioral health?
I would say it's okay not to be okay. It's okay to ask for help. And visit kids.ri.gov. See if we can help you and your family. And share the word, spread the word. Maybe you don't need this service, but maybe you know and love someone that does. So thank you.
Yeah, that's a mic drop right there. There's no better way to come to an end of the podcast. Ashley and Ellie, thank you so much for your time. This has been so impactful, so full of resources. I know our community is going to eat right up. So once again, for those who are listening and want to get in contact, what's the best way they could reach out?
On kids.ri.gov, we do have a contact us button, and you can contact us there.
Right. So thank you again for your time. We hope you have a great rest of your day.
It was
Thank
great
you.
meeting you both.
Appreciate it. Bye.